right, our last chapter of the course. It is the longest chapter. It has the most information, so it is divided into 4 different sections because it is going through all of the different medications that are commonly used in the surgical environment, and there are a lot of them. So our learning objectives are actually simple. It is identifying the main classifications and then differentiating between the types. So we are going to be covering the gamut of all of these different medications. So it is just knowing what those drugs are and what they are used for. To get started, just the classifications of the medications. So all medications have a principal action, which is determined by their chemical, by the chemical that makes them. So for example, opiates or opioids or barbiturates or benzodiazepines, that puts them in a category that is based on their chemical structure. So they all have a very similar chemistry. Unfortunately, it doesn't necessarily give us an indication as to what they're doing, which is kind of what that name implies. So it's a bit misleading. So again, principal action is determined by the chemistry. So again, barbiturates, benzodiazepines, big classes of molecules based on the chemicals that make them up. The body system affected, that's pretty intuitive. So is it impacting the central nervous system? Is it affecting the cardiovascular? What's it doing? The physiological action is what it's actually doing to that body system. So is it increasing heart rate, decreasing heart rate, increasing neurotransmitter release? Is it causing muscle contraction? What is it actually changing within the cell? And then the therapeutic action, which is kind of what you would think of maybe with the principal action. So those two are a little tricky to keep separate. So again, remember principal action, it's kind of putting them into a group based on their chemistry. Therapeutic action, that's actually what benefit it's providing. So anticonvulsant, so it's preventing a seizure, or something for like a beta blocker that's used for high blood pressure. So again, that's what it's actually being used for. So what benefits is it providing? An anti-inflammatory, antipyretic that's helping with fever. So what is it actually benefiting? Now the different types, we're going to list the entire laundry list. There are 2 slides of these. My suggestion is that you use note cards for these. This is just straight memorization to help you know what these terms are, and then the information that goes along with them. So we have amnesics, analgesics, and antipyretics. Often molecules are both of those things. That's why we talk about them together. Anesthesia agents, of course, in the OR, lots of anesthesia. It's important to understand how that works. Anticoagulants and fibrolinetics, anticonvulsants, antiemetics, so the anti meaning it's stopping that. Antihistamines, anti-infectives like our antibiotics and antivirals, anti-neoplastics, those are going to be our chemotherapy medications, autonomic agents, so this is referring to this central nervous system, blood replacement interventions, again, OR, we're possibly losing lots of blood, cardiovascular agents, CNS stimulants, coagulants and hemostatics, contrast media, diuretics, dyes and stains, emergency drugs that are common in the OR. We'll learn there's an emergency card and what goes on that. Emetics, gastric agents, hormones, inhalation agents, irrigation solutions, again, lots of times flushing out the openings, IV fluids, lubricants, narcotic antagonists, narcotic analgesics. So we have just regular analgesics and antipyretics. Then we also have the narcotic analgesics. Obstetrical, wow, I'm having a hard time pronouncing that apparently, but OB agents, let's make it short. Ophthalmic agents, sedatives and hypnotics, vagal blockers, vasodilators, and finally our vasoconstrictors. All right, so starting this again, covering these into 4 different sections. So amnesic, so if you kind of think about amnesia here, kind of the root of that, So this is actually given prior to or even during surgery, and it's to actually cause memory loss. So again, amnesia is when we forget things. So oftentimes these are given so that individuals will forget what is happening, or going into the OR just kind of helps their body relax and stay calm. An example of this is midazolam, or Versed is the trade name, which is a benzodiazepine. So that would be that principal action. It's putting it in a category there. Now for these, unless I would say otherwise, the examples that I'm using are just in case you would happen to hear of them, not really a test question. So I'm not going to say what is midazolam, because I'm also using that because, as we'll see, a lot of these drugs have multiple effects. So they could be used or prescribed for different reasons, even though it's the same medication. So this Versed is an example of an amnesic that is used to cause temporary memory loss. And mainly what I want you to know here is that amnesics induce temporary memory loss. Now, analgesics and antipyretics. Analgesics are pain relievers, so they're used to treat pain and have different strengths of these, so different doses, and that's what can determine which one is used. Antipyretics, these are going to be fever reducers, so pyromaniac, think of that like hot and fire, so stopping the fire, which is fever. So some perform both by inhibiting a signaling pathway called that uses COX enzymes. So by inhibiting that, it treats pain and reduces fever. So for example, aspirin, which is the salicylates, acetaminophen, which is our Tylenol. This one is, unlike the other ones, doesn't inhibit inflammation. So aspirin is also anti-inflammatory. Tylenol is not. So it does help with fever, it does help with pain, it does not help with inflammation. And then our other one, the NSAIDs, which stand for non-steroidal anti-inflammatory. So they are anti-inflammatory, but for the sake of this slide, they also treat pain and they reduce fever, and these are things like ibuprofen and Aleve or naproxen. Now, anesthesia agents. These, of course, are used for sedation and managing intraoperative, so during the operation and post-op pain. General anesthesia is often given either by inhalation or injection. So inhalation, again, or IV. We have local nerve blocking agents that can be used as well. So we have general anesthesia that is going systemically, and we also have local anesthesia that is going to a targeted location. So it's blocking specific nerves to prevent pain signals from one area, not the whole body. All right, so there are a couple different types of these local anesthetics, aminoamides and amino esters. And then also there is a red coloring that is often put on the label. That means that epinephrine has been added. And sometimes those without epinephrine are called plain. So epinephrine will come back to epinephrine and the aminoamides and esters. But again, the presence of the epinephrine is just easy to identify by having that kind of red labeling on it. Now the general anesthesia, again, this is going throughout the body. So systemically, again, we have inhalation or injection. So inhalation, these are agonists of inhibitory neurotransmitters. So agonist, again, means it's activating or mimicking the actions. So these are going to bind to these receptors and activate them, even though the chemical that's naturally there isn't there. And these are inhibitory. So some neurotransmitters activate things and action potentials, inhibitory prevent them. So this stops pain because you have these inhibitory neurotransmitter receptors being activated. So it's putting the brakes on that signal. They're also antagonists of the excitatory receptors. So by having both combinations, it produces an inhibitory response that prevents pain from being transmitted. It also decreases tissue excitability, so it's going to help kind of calm the muscles and relax the patient. The most common ones of these are ethers. So if you've heard of ethers, these are volatile liquids, which means they easily evaporate. That's why they're given by inhalation. Desflurane, isoflurane, sevoflurane are examples of those. So again, they kind of have that common fluorine at the end, so it helps you to identify them. And then we also just have gases. So the ethers are volatile liquids, but we also have gases like nitric oxide, or laughing gas, as it's more commonly called. It is the least potent, and it's rarely ever used alone. Instead, others are actually added with it. Now, the intravenous, these have a more sedative effect. So the benzodiazepines, like the Versed or the midazolam we just talked about earlier, that was an amnesic, it's also under this category. So it induces anesthesia, sedatives, but it is not an analgesic. It does not help with the pain transmission. Again, midazolam is an example here. Some of these are dissociatives. These are also analgesics, so they do help with the pain. So it's often used in trauma to kind of have a double whammy effect there. Ketamine is an example of this. So it's both a pain reliever and an anesthetic. Etonimide is a cardiovascular stable, so someone that has, especially elderly individuals that are known to have some heart risk. This is a safer alternative for those. Barbiturates, these enhance GABA, which is our main inhibitory neurotransmitter, so it makes it work better, which increases that inhibition. And methotrexate is an example, propofol, and thiopentanol, which has a very short duration of action, so not good for long-term surgery or a long surgery, but thiopentanol is one. Now, anesthesia antagonists, so because these are sedative in nature, they can have overdoses, so antagonists would block them. So this would be benzodiazepine reversal. So again, too many benzos were used, flumazenol, can be given to reverse those effects. Our opioid reversal, naloxone and naltrexone, both of those would remove those opiates to prevent that overdose. Now, the local anesthetics, the two types, aminoamides and aminoesters. The aminoamides are biotransformed or metabolized in the liver, so it can cause some toxicity if there's abnormal liver function. So again, if the liver's not working properly, it's not breaking down these aminoamides, and that can cause them to have a higher dose because they're not being broken down, which can lead to some toxicity. An example here is lidocaine, which is commonly used again in dental offices to numb the gums. Our amino esters are biotransformed or metabolized in the blood, in the plasma by an enzyme called pseudocholinesterase, which is an enzyme, that is made in the liver, but is actually broken down in the blood plasma. An example here would be Novocaine. We also have agonistic anesthetic agents. So if we use some of these terms, again, agonist means that it's working together, it's enhancing the effect. So this is helping the anesthesia work better. So the two meds that are commonly used with them to enhance or prolong their effect. So epinephrine is one, and that's why that red labeling is on many of these, is because they have that agonist. So adrenaline is the more common name, but epinephrine helps that local anesthetic work better. And the reason for that is it's a vasoconstrictor, which means that it's closing off those blood vessels, which help that agent stay in that place. Because again, these are local, they're not going all over. Well, how do they not spread throughout the body when you're injecting them? Well, epinephrine helps with that. It helps keep that in the site of injection. And then hyaluronidase. This allows the agent to penetrate deep within connective tissue. So hyaluronidase, hyaluronic acid, if you remember some of your AMP that's involved in your connective tissue, especially your joints. But what it's doing is by using this and breaking down that hyaluronic acid and that layer, it helps to get into that connective tissue. And these are administered parenterally, which means not through the GI system. So again, some type of injection. Now, some of the complications that can occur with anesthesia is an adverse reaction to those that can lead to anaphylaxis, which is a severe kind of toxic effect of these medications. Hemolytics, which can cause the blood vessels and blood cells to rupture or lyse. Idiosyncratic, just meaning there's not really a rhyme or reason, they're just reactions that happen. Individuals can aspirate, which means that they're not breathing properly, or they kind of regurgitate and then end up swallowing some of that. So aspiration is common. Cardiac impact, so again, it's not always advised that elderly individuals go through with some surgeries if they're not life-threatening, is because their heart may not be able to withstand the anesthesia. So it can cause that cardiac arrest as well as dysrhythmias, where it's just not beating in the correct order. We can also get injury from these, like corneal or oral, and that's just from injecting, again, if in the dental office, if they're not numbing those gums just right, it can cause some injury. There's also the possibility of what's called malignant hyperthermia, hyper meaning high temperature here. So that can also then, or another effect is shock, like cardiogenic shock, hemorrhagic shock. So cardio is affecting more the heart. Hemorrhagic is those blood vessels, the blood cells kind of breaking down. And then it can also lead to spasms, like bronchospasms, where it makes it harder to breathe because the bronchi are contracting and kind of spasming. And then also laryngospasms, which is the same thing, just in the larynx. Now, the anticoagulants and fibrolytics, anticoagulants prevent blood clotting. A couple examples, heparin and warfarin, these are the most common. Because of that impact, oftentimes these would be monitored very closely so that we're making sure that the levels are the same. There's not an issue like with the liver not breaking it down or speeding it up. So they are highly monitored, and individuals with them often have to get blood work kind of regularly while they're on them. Now, fibrolytics is different. So it kind of has the same impact. So it's stopping blood clots, but instead of preventing them from forming, like our anticoagulants, they are also called thrombolytics, and they destroy the fibrin, which is the main part of a blood clot. So anticoagulants prevent them from forming. Fibrolytics are going to actually break down the blood clot. So different reasons for giving each of those. And some examples are tissue plasminogen activator, or TPA. The other one is retiplase. All right, so our anticonvulsants, again, anti meaning not or stopping, convulsing is seizures. So these would also be called antiepileptics. They prevent or reduce the effect of a seizure. And some examples, midazolam is back again. So again, I'm including some of these just so that you can see that one drug can have lots of different therapeutic actions that can be prescribed for various reasons. And then phenytoin or dilaudid is the other example. Now, antiemetic, again, we're stopping something. Emesis is vomiting. So this is going to reduce or eliminate nausea and vomiting, which is common on individuals that are on anesthetics. So these are often given to prevent that. It's a collection of lots of different drugs from other categories that have this more as a side effect, but that's why it's being used. So for example, antihistamines, some uses for these, they treat side effects from general anesthetics. So again, preventing that nausea and vomiting, also from opiate and opioid analgesics and chemotherapy agents. These also can even be used to treat morning sickness during pregnancy, as long as they are safe enough for the fetus. Now, antihistamines, so again, these are going to block H1 receptor antagonists, which are those most involved in allergic reactions. So those reduce or counteract the effects of histamine during that allergic reaction. And the histamines are released from cells called mast cells, and that's why the presence of those indicate or whether something is or is not happening. An example of an antihistamine would be Benadryl. That's kind of a common one that gets used, and it is an H1 receptor antagonist, which is a histamine receptor specific antagonist. Sorry. Antineoplastics or chemo drugs. These are used to treat cancer. Several different classifications of these. They're often prescribed alone or with other therapies, and more they're given with multiple ones to try to wipe out and prevent mutations from occurring. But because they are inhibiting cell division, they can have toxic effects because they're not just targeting cancer cells, they're just generically decreasing replication. Now, autonomic agents, to kind of wrap up this section. So this involves involuntary portions of the CNS. So autonomic is kind of self. So this would be the involuntary portion. Now, the autonomic nervous system is divided into the sympathetic and parasympathetic. Sympathetic is a fight or flight response. This gets activated by a specific type of neurotransmitters called adrenergic neurotransmitters. So like epinephrine and norepinephrine. Parasympathetic is rest and digest, and this is activated by cholinergic neurotransmitters like acetylcholine. Now, the types of autonomic agents, we have adrenergics, and those are going to mimic this cycle. Adrenergic blockers, obviously to block them, cholinergics and cholinergic blockers. Each of these, the adrenergics, these are going to mimic the sympathetic nervous system, which is that fight or flight response. So this is going to dilate the bronchioles. We need more oxygen in for that energy demand. Stimulates the heart, contracting more, getting more fuel to the body, and increase blood flow, again, delivering that glucose. Some examples here, ephedrine, epinephrine, dopamine, and others here. Again, we see that epinephrine again here, just like that agonist for the local anesthetics, it is an adrenergic as well. Then we have the adrenergic blockers, alpha and beta. Those adrenergic antagonists are also sympathetic. So these are divided into alpha and beta. So alpha relax the smooth muscle of the bladder and prostrate, especially during high blood pressure. Doxazoin is one of the main ones that gets used for that. Then the beta blockers, these reduce hypertension. It's resolved cardiac dysrhythmias, can also lower intracranial pressure for like individuals having issues with their eyes. They relieve angina pectoris and migraine. So a few different uses for these. But again, these agonists are going to block that adrenergic system. So they are blocking the sympathetic nervous system. The last part here for this one, the cholinergics, these are parasympathetic and muscarinics are some other terms used. So they are mimicking the parasympathetic, that rest and digest. So that's going to slow the heart rate down. It's going to increase secretions, constrict the pupils, again, etc. Lots of different things going on. Some examples here, the Bethacol is one of the main ones. Then the cholinergic blockers. So while the cholinergics mimic that parasympathetic system, the cholinergic blockers like anticholinergics and antimuscarinics, they block the parasympathetic nervous system. So that will decrease the secretions, dilate the pupils, and essentially have the same effect as activating the sympathetic nervous system. So some examples are atropine and the scopolamine that are used. And again, so whether We have the adrenergics and cholinergics. They are activating, for adrenergics, activating the sympathetic, cholinergics activating parasympathetic. But then we have the adrenergic blockers. That essentially is blocking the sympathetic. So it's the same thing kind of as activating the parasympathetic. And then the cholinergic blockers would be blocking the sympathetic, which is the same thing kind of as stimulating the sympathetic.